we are extremely intimately connected with light. Red and infrared light are going to speed up recovery no matter what. When it comes to lasers and LEDs, there are some differences. Both of these modalities can be summed up in a term called photobiomodulation. And that's a fancy term that just means changing life with light.
Most of the audience consists of those with thyroid conditions. If it's a choice between laser and LED, you would say that laser therapy is maybe a better option when it comes to healing?
Roughly 20 articles in the peer-reviewed literature that looks at what happens to the thyroid when you use photobiomodulation over it. And most of these are studies using LED, right? And so the studies all agree that this is a good thing for the thyroid. You see anything from reduction of antibodies to reduced need of medication to just general, reduction in thyroid symptoms, etc.
Do you know if laser therapy can help with Graves?
So what we've found is
So I am super excited to chat with Dr. Brandon Crawford. We are going to be talking about laser therapy, tying it into thyroid health, talk about LEDs. I mean, it's going to really be a great conversation. So before getting into the conversation, let me go ahead and dive into Dr. Brandon's impressive bio here. So Dr. Brandon Crawford is a renowned expert in functional neurology and photobiomodulation with a focus on brain rehab and regenerative medicine. He holds degrees from Texas A&M University and Parker University, including a doctorate in chiropractic. As a licensed chiropractor in both Texas and Dubai and a fellow of the International Board of Functional Neurology, Dr. Crawford leads in his field. He's the pioneer and founder of the Neurosolution Center of Austin and co-founded the Neurosolution Center of Atlanta and related ventures. Dr. Crawford is co-founder of Neurosolutions Products, a global medical distribution company. He is a laser expert and is pioneering a new and innovative form of laser therapy. He has personally developed and designed the 528 Innovations Therapy lasers, a global lecturer. He's known for his work in laser and light therapy within functional neurology and is authoring a book on neuroplasticity for brain injuries. Dr. Crawford champions the Neurosolutions ESM methods, focusing on energy, sensory, and movement, and is a sought-after speaker on diverse healthcare topics. And he has now begun educating the masses through his podcast series, The Longevity Formula, which can be found on all major podcast platforms and YouTube. And welcome, Dr. Crawford.
Man, thank you so much. You make me sound really good. So whoever wrote that, I'm really happy that they wrote that for you. Thanks, man. I'm really happy to be here.
Yeah, no, same here. Like I said initially, it is an impressive bio. And so you are working on a book. When is that? When are you planning on having that released?
So it's actually finished. It's been finished for a while. And I do have a book agent. And one thing that he's telling me is that, hey, this book is really good. What are your goals, right? And my goals with the book was really to help patients and caregivers navigate through this process of brain injury. It was something that I really think was needed. People reach out to us all the time and they're in the ICU or they just got admitted to the hospital or something like that. And they really need answers. And so the purpose of the book was really to help those families navigate these scenarios. And one of my initial offerings actually came from Nova, and which was exciting. And I love the idea of, being published in academic text and whatnot. But that didn't really jive with the goals of what I wanted for the book. And so we're in the process of talking to different publishers and really just trying to, make sure that we get this book out there properly. So hopefully, I actually have a meeting with my book agent here in the near future. Hopefully he has some good news for me, and that will be released in the very near future.
All right, awesome. Well, good luck with that. I'm sure it'll work out. So how did you become known as an expert in laser and light therapy? If you could get into a little bit of the background before we dive into the subject.
Very good question. And I guess the way that I would want to answer it is I've always been extremely intrigued by light. I'm personally, I have a strong faith. And so I grew up in the Bible Belt of Texas, small Texas town and everything. And so I just remember sitting in church one day and hearing that God created light before he created life. Now, it wasn't spoken that way. That wasn't how the message was delivered, but that's what my mind heard. And so from a very young age, my mind was wrapped around this concept of there is this very intimate connection with light and life, and one does not survive without the other. And so it really set things into motion. The funny thing is, when I was, I guess, in junior high, I was having a chest surgery. I had to have a reconstructive chest surgery. And my parents, they were like, "Hey, we'll get you anything. What do you want? Do you want a video game? What do you want after your recovery?" I said, "I want a laser." And they were like, "What? You want a laser?" I was like, "Yeah." And I was just talking about those little like pin lasers, right? That's all I wanted. I was that infatuated with it. So they were like, "Okay, we'll get you a pin light laser." And so I was, in recovery after the surgery, I was like playing with this laser, pointing it at nurses and all this kind of stuff. So it's always intrigued me. And there's this whole story about how I fell into the profession of chiropractic. I wanted to be a neurosurgeon, and then I got married and I looked at divorce rates of surgeons and I decided, I really like my wife. I'd rather not go into that. I'm kind of a nerd when it comes to researching and probabilities and numbers and all that. And so I kind of took a turn. I got accepted into pharmacy school. I actually got accepted to multiple pharmacy schools. And I was actually just praying, trying to decide which one to go to. And this voice in my head clearly and loudly said, "You are not going to pharmacy school." So it made me start to think through, okay, what am I supposed to do? And I was led to actually go shadow the chiropractor that helped me after I had a failed back surgery in high school. So I did. I went and shadowed this chiro, fell in love with that, but I knew that that wasn't the form of chiropractic that I was supposed to do. And so when I was in chiropractic school, my first semester there, Dr. John D'Onofrio, he was the president of the chiropractic neurology board at that point in time. He did an impromptu lecture on how stimulating physical receptors can influence the brain and nervous system. And I went up to him and I said, "You don't know me and I don't know you, but this is exactly what I'm supposed to do." And so he took me in, at that stage in my career, I was just getting started, man. It was amazing. And so I got to start to learn functional neurology then in my career, and it was amazing. And this does dovetail into the laser question, because here's what happened is I got to start really listening in and helping out on the cases that Dr. D'Onofrio was seeing. And one of them was actually a rare pediatric genetic brain disorder. And it was a disorder where the brain does not really develop, right? And sometimes it ends in severe retardation. Sometimes it ends in death. Like, it's one of those conditions where the brain just doesn't develop. And I remember working through the case with him and I'm like, "What are you going to do?" And he said, "Well, they've tried everything. Like, they've been all over the world. They've done everything that there is to offer, but they haven't used laser on the brain." And this was still when that wasn't really a thing, right? Using laser therapy on the brain is relatively new, right? Over the past, maybe 20 years is really when it's been started to be looked at heavily. So this was roughly, 16 years ago or so, maybe 17 years. And I was like, "Laser the brain? What are you talking about?" He said, "Yeah, we're going to laser the brain. It has a very high safety profile. Like, this is something that could potentially help." And so that's what he did. He started using the laser on the brain, started doing, some of the functional neurology work that he does. Fast forward, I think he did that for about a year's time. At one of the checkups, the doctor comes in and he's like, "Well, this must be the wrong patient because this is not what I would expect out of this diagnosis." And the kid developed in ways that wouldn't, should not have happened. At that moment, right, when I saw this play out, I knew. I was like, no matter what I do, whether it's functional neurology, whatever it is, lasers is what I've got to really attach to. And so that really not only, piqued my interest even more, but it just set a fire under me to figure out, like, why did this help something that all medical literature, everything says this shouldn't happen? Why did this work? Right. And so I really just spent my career trying to figure out the kinetics of it, the physics of it, like all of that kind of stuff. And the cool thing is that it's really set things in motion to get me to where I'm at today. So that's believe it or not, the short answer of, how this has happened. So I don't know where you want to go from there, but that's kind of my story in a nutshell and how I fell into this laser therapy thing.
Yeah, I guess let's start by maybe giving an introduction to laser therapy for those who are not too familiar with like wavelengths. I don't know if you want to go into like laser beam physics. I mean, obviously
Mhm.
not too much in depth, but I guess just give maybe an overview.
Sure. So, laser and light therapy, I think we first need to understand that there are some differences when it comes to lasers and LEDs, right? LEDs are not laser diodes. You will get a you will get a slightly different response. It really depends on the goals that you're trying to achieve. And by the way, I use both. I'll use laser diodes. I'll use LEDs. You can find both in my practice. You can find both in my home. Here's how I'll describe it: is just like I would describe the differences in a Ferrari and a Kia, right? They're both cars. They're both going to get you from point A to B, but the Ferrari is going to get you there a little faster and more effectively. Now, that's a very crude way of kind of describing laser versus LED. But when I want to be very specific, very efficient, I have a very specific target or goal in mind, I'm reaching for my laser diode. I'm reaching for my laser. And oftentimes, I want to be sure and use this specifically over my brain. Now, I use my laser over my thyroid, I use it over everything, right? All my body. But if I want more of a generalized healing experience, right? I want to, in general, reduce my inflammation. I want to improve my well being, all this kind of stuff. I'm good to lay under my LED panel, right? So, very different goals, both very beneficial. The concepts of both of these modalities can be summed up in a term called photobiomodulation. And that's a fancy term that just means changing life with light. And what we need to understand is that we are extremely intimately connected with light. We have so many different cellular mechanisms that are set into motion or not set into motion based on the type of light that we are exposed to. Now, we're typically underneath this high frequency white and blue light. I'm not. I had a certain type of light put into my office so that I'm not subjected to those harsh wavelengths. But we need to understand that even that exposure to light is driving certain cellular processes inside of us. It can promote inflammation, it can promote obesity and diabetes, and all of these things. To combat that, we need to understand that there are certain wavelengths like red, near infrared, that actually help to combat the exposures, the excessive exposures to the white and the blue light that we are subjected to so much. And that's why you have seen this huge propagation, whether it be in marketing or clinical use or whatever, of all of these red light devices. They're good. They help us heal faster. They all of these things, but the need is there specifically because of the type of light exposure that we're subjecting ourselves to on a daily basis, right? So someone that lives in Costa Rica and they're outside in the sun all day, they're going to be less responsive to a red light panel or a red laser, right? They're going to be less responsive because they're not sitting under these toxic lights all day, right? Now, I can argue that in multiple different directions. If someone has an injury of any type, what research has demonstrated is that red and infrared light are going to speed up recovery no matter what, right? So that's the beautiful thing, is that we now know certain things about certain wavelengths. And when I'm talking about wavelengths, what we need to understand when I say that is just think about the color of light, right? So red has a different wavelength than green, has a different wavelength than purple, and etc. We can talk about like the differences in all of those wavelengths if we want to get a little more granular. But as you change the wavelength, you're going to be influencing different receptors inside the cell and inside the body, right? So we know that red and infrared will accelerate healing, they'll improve blood flow, they'll improve neuroplasticity, they'll do all types of different things for us that are very, very beneficial. So when it comes to, if I could just summarize, like, what is this laser and light therapy thing? Where did it come from? I think the overarching message is, hey, this has been around for a very long time. Research really began in this field in the 1960s, looking at how red light influences various different things. There's thousands of studies for photobiomodulation. There's hundreds of human clinical trials. This modality, this is so safe, so effective, that I personally think that every provider needs to be using it. I think that every home needs to be leveraging some type of photobiomodulation. That's my own personal feelings about it. But it's something that as we continue to move forward in medicine, I do believe that this is at the front edge of it. And I can, go into elaboration about some of the studies we're doing to push that forward, but those are my initial thoughts on it. I don't know how granular you want to get into the details, but you let me know.
Yeah, no, I think that was great. One thing, so you were mentioning that LED is like maybe for more generalized treatment, generalized inflammation. So for those listening, most of the audience consists of those with thyroid conditions, thyroid autoimmunity. So if they are using, if it's a choice between laser and LED, and I understand you use both of those, and there's nothing wrong with using both of those, and you could get benefits from both. But if there is a choice to help with thyroid healing or helping with the immune system, you would say that cold laser, that laser therapy is maybe a better option or more specific option when it comes to healing?
Yes, very good question. And I will agree with you. Both are a good option. In my experience, what you're going to find is that if you use a properly made laser, right? You use a laser that is the right wavelengths, the right calibration, the right frequencies, the right all of those things. I'm going to explain that in a little bit more detail. You will get results faster. Now, to date, there's roughly 20 articles in the peer-reviewed literature that looks at what happens to the thyroid when you use photobiomodulation over it. And most of these are studies using LED, right? Most of them are those studies. And so the studies are they all agree that this is a good thing for the thyroid. You see anything from reduction of antibodies to reduced need of medication to just general, reduction in thyroid symptoms, et cetera, right? So across the board, you see very good results when you're using photobiomodulation for the thyroid. There are some studies that would suggest there's no difference in LED versus laser diode. I would suggest that there were some metrics that you could have looked at otherwise in those studies that were not looked at. But then you also have studies that suggest the laser diode is more effective than LED. And I'm just laying this all out there for everyone out there because I know that there's probably some really intelligent listeners out there. Me personally, I've done pilot studies in my office, and then I've also done tests on myself because I have both Hashimoto's and primary hypothyroid. And my thyroid responds best when I use a properly calibrated laser over my thyroid versus using the LED panel. I get response both ways. I get a better response with the laser. Now let's talk about the laser physics because no laser is made equal. Okay. And this is the best way I can explain laser physics, right? If I'm having this conversation and I'm speaking to you and I just say, like, how are you today? Right. So I say those words, how are you today? And I say them in just a nice, relaxed way. You're going to have a certain neurophysiological response. But if I yell the same words at you, right, just scream, how are you today? Right, that will evoke a different neurophysiological response in you. So here's the argument. Same words, different response. So it's not just about delivering photons, right? That's not what it is. It's about the quality of the laser beam. It's about the laser beam physics. What's the polarization? What's the pulse rate? What's the duty cycle? Like all of these things shape the voice, if you will, of that laser beam. And this was really, really shown to me initially by the work of Todd Ovakaitis. And Dr. Ovakaitis was able to calibrate a laser beam that specifically spoke to V cells in plasma. And V cells are a type of stem cell. It stands for very small embryonic-like stem cell. And I thought that was so amazing that here you can shine a light into plasma and you can change surface receptors and activate stem cells specifically based on the physics of that laser beam, not just the wavelength, not just the frequency, but so many different factors, right? And so that really showed me the importance of a properly calibrated laser beam. And number one, that understanding that, not every laser is made the same, but number two, just understanding that if we do this right, the effects are so far reaching, right? And so that's what a lot of my, pilot work right now. I'm designing 3 different studies right now. We're looking at, yes, how can we continue this work and not have to draw someone's blood to activate those V cells? How can we do this from just using a laser exteriorly on someone? And then we have other things that we're looking at as well. But that's where it gets really, really exciting, is when we can really tailor that laser beam because we understand the physics of it now and have a very specific neurophysiological response. That's where I get so excited.
So when someone goes on Amazon and just gets a laser for $200, that isn't necessarily the same as a laser that you use in your practice, or maybe even not the same as lasers that you give someone, because you do give like sometimes home units as well, or recommend home units for people.
Right. And you're correct about that. If you want something and you just want the cheapest thing, go LED, right? If that's what you're looking for. When we write a home care for someone and they want to include laser therapy at home, we write that home care specific to the type of laser that they're going to be using. And we only recommend the lasers that we have in Neurosolution, which, obviously Neurosolution is selling the 528 Innovations laser that we developed as well. So we're very specific about that. But yeah, if you're looking just for the lowest cost solution, I would definitely suggest going LED for several different reasons. I already talked about the physics, but when you get a cheaper laser diode, it's probably not going to last very long. That laser diode is going to be subject to heat. That laser is probably not very well cooled. That diode's probably going to crack, and you're going to have a whole different wavelength shooting out at you. So many different things. So if you're going for a cost-effective thing, man, go LED.
Okay. So cost effective, go with LED. But if someone has a thyroid condition, LED can help. But if they're like, let's say someone has Hashimoto's and they're looking to heal their thyroid, address their immune system, LED, again, over the long run, it might help, but they're looking for quicker results. It just sounds like that they probably should see a practitioner like yourself.
Absolutely. As always, work with someone that knows what they're doing. Not every physician knows how to navigate that scenario from a laser perspective. And as you well know, there's going to be so many different factors that go into that patient that need to be addressed too, right? I'm not going to make the statement that, yes, just laser your thyroid and it's all going to go away, right? That's not at all what I want to promote, but it can definitely aid to someone's recovery. And actually, and I'll say this, like I have personally been in remission from Hashimoto's. I have. And I have to do more than just laser my thyroid, but that is part of my routine. So I can do that. Now, I am very, very good at getting myself out of remission, right? I'm really good at spiking my antibodies and driving my TSH up. I know how to do that. But understanding that is, how I know how to flip it and get better.
Yeah. So based on what you just said, I think it's safe to say that laser can help, but probably alone is not going to get someone in remission. So if someone just goes to a chiropractor or another practitioner to get laser therapy, but they're not incorporating diet and lifestyle factors, maybe they need to do some other functional medicine testing. But if that's all they do is the laser, they're probably not. I mean, maybe they'll get some results, but it's not by itself necessarily going to address the cause of the problem.
Correct. And the way that I like to explain that is whatever you do, if you add photobiomodulation to it, you're going to enhance the results, right? Think of it like an accelerator. Think of it like just an additive to whatever therapies you're doing, right? And I've had the benefit to be able to work with healthcare professionals in so many different regards, whether it be chiros, PTs. I've worked with oncology. I've worked with orthosurgeons, neurosurgeons, speech therapists, gastro docs. I could go on. And it's just because, I have been in this field. And so I get to consult, because the number one thing when a provider gets a laser is they typically go, okay, great. How do I use it? So I get to be that guy, walking through best use cases for certain demographics of patients. And that's kind of the prevailing thing is, look, you're doing good work. If you want to move the needle even more, add photobiomodulation to what you're doing, and you're going to enhance results even more.
Have you had any experience with Graves' disease? Do you know if laser therapy can help with Graves, if there are any contraindications?
Yes. Okay. So I have personal experience through my patient base using photobiomodulation with Graves. What we need to understand, and this is found in the research and then also through clinical experience, is that photobiomodulation, laser and light therapy, is very regulatory in what it does, right? So it's going to regulate systems. So and we see this played out in the literature with NF kappa B, with calcium influx into the cell, with all different examples. With the thyroid, specifically with Graves, what you're going to see is if you have hyperfunctioning, right? If the thyroid is functioning too high, once you start to employ photobiomodulation, it will begin to regulate and bring it down. If you have hypothyroid, if it's low functioning, once you use photobiomodulation, it will begin to bring it up. It regulates systems. And again, this is very consistent in the research. Now, this is my clinical observation. What I've seen with Graves is that for some reason that I'm still trying to figure out why, there's this transient like spike, right? So we start working with someone and it's like we get a flare, right? And that can oftentimes be within a week or 2 weeks. And then it comes down. It's not like it's this, pathological state where they're worse, whatever. It's this little flare. And so I started thinking through it similarly to how I think through seizures, because we noticed that with seizure disorders too, when we started using laser therapy for seizures, there would be a transient uptick and then subsequent reduction. And ultimately, I've actually seen seizure disorders eliminated, even genetic disorders eliminated. And so I started thinking through it must be related to how much energy we're delivering to the system. Are we overdoing it? Are we giving them too much in too short period of time, et cetera? And so what I did is I started using more infrared on that patient when we would start with them, because in infrared, specifically near infrared, it's a longer wavelength of light, right? So the infrared spectrum is invisible to the eye. So it's a wavelength color that you don't see. The wavelength is longer, it penetrates deeper, but the energy per photon is less. So it's a less energetic photon that's being delivered than, say, a red photon. And so once we made that flip, once we made that change, it really eliminated that little flare that we see in these autoimmune patients, not just Graves' disease, but other autoimmunities too. So with that strategy, I've really been able to navigate it, but I do still tell people, hey, initially just beware, in the initial week or two, you might get this little flare, stay with it, and it should regulate.
Okay. That's very good to know. Very important to know for someone with Graves getting laser treatment. So thanks for explaining that. How about just getting natural sunlight? How important is that compared to just like if someone's doing LED every day, let's say, and then they also on top of that doing the laser, do you also recommend for them to get natural sunlight too on top of that?
Absolutely. I think that's a non-negotiable, just to be honest. Here's the thing. I can make the best laser in the world, and I'm biased, but I think I have. But that still is not going to replace the sun. And I can discuss this from multiple angles, but the angle that I really like to speak from in relation to thyroid is how the aromatic amino acids that ultimately end up forming things like our thyroid hormones are subjected to various wavelengths of light. So, for example, in the morning, when we're getting that early morning sunrise, that's a non-negotiable. We need to be experiencing it. We need to be outside, not wearing sunglasses. We need this light coming through our eyes. We need it being exposed to our bodies. And what's happening is the benzene rings in the aromatic amino acids, specific to thyroid, we're talking about phenylalanine, it's absorbing the UV light, specifically between 250 to 380 nanometers. And what's happening is think of it like charging these amino acids to then go through and produce things like T3, T4, even things like our dopamine, epinephrine, norepinephrine, all of these neurochemicals. So that exposure to that wavelength of light in the morning has to happen, right? And To date, there's nothing that really replicates that. I've been asked to start to, create something that replicates it, but to date, I don't know of anything. And why would you? It's free. Go outside, get your sunlight. Now, obviously, in areas where it's dark all the time, okay, that's where we need this, but you cannot replace that. That natural circadian rhythm has to be in place for a proper functioning thyroid and so many other things. I would also argue getting midday sunlight as well. So those longer far infrared waves, I think that's extremely important. And then I also believe it's important to be outside as the sun is setting. You get a whole different wavelength of sun at that point in time. Not specific to thyroid, but kind of specific to thyroid is the interaction of sunlight to melatonin. So melatonin is created in light, but then expressed in dark, right? So if you're having trouble sleeping, and there is a correlation with melatonin and TSH, and so there is a connection here to the thyroid. But if you're having trouble with melatonin production or sleep or something like that, maybe it's not only the nighttime routine, but maybe it's the morning routine, right? Maybe you're not getting those proper wavelengths of light to generate enough melatonin and all these other neurochemicals that you need in order to sleep, in order to heal, in order to get proper growth hormone pulses and all of these things that we need throughout life. So it's a non-negotiable. And again, I didn't really go through this part of my story, but a big part of my story actually involved me getting pretty daggum sick. I was so run down. I had no energy, brain fog like crazy. I was running a high volume practice at the time. It was insurance based, high stress. I had 2 young kids. I had a great wife at home, but kids they were great, but it was just, they're kids. I was stressed to the max, and I did all the things I knew to do, all the supplements, all the diets, all the things, but I just couldn't get away from the stress. And so my TSH was 25, my thyroid antibodies were off the charts, and my medical team was talking about doing biopsies because they thought I may have, thyroid cancer. And when I heard that, I was like, okay, I'm done. I sold everything and I moved to Costa Rica. And when I was there, I really, really understood the benefit of natural sunlight and setting this natural circadian rhythm in motion. And I didn't do any supplements. I didn't do any medications. I didn't do any lasers. I was using the sun. We were like literally naked in the jungle all day, every day. It was amazing. When I was there after about the 3-month mark, my lab work was completely normalized. I felt better than I did in my entire life. So there is a non-negotiable of needing to get outside, get proper sun exposure at the right time of day, right? As much as you can. It's a non-negotiable.
Ideally, how long should someone be in the sun? You mentioned like first thing in the morning, midday, right before sunset. I mean, if someone is only outside for 5 minutes at a time, I mean, it's better than nothing, I'm sure. But if you would say optimally, from an optimal standpoint, how long should someone try to be outside for?
Yes. Okay. So what we've found is if you're just trying to maintain optimal health, if you go outside while the sun's rising, within the initial 1 to 2 hours of sunlight, if you spend 10 to 15 minutes out there, I like to be moving. So whether you're just taking a walk or you're stretching or something like that, that's typically enough to set the proper neurochemistry in motion. If you're struggling from some type of health condition, Hashimoto's or Graves or whatever, I do suggest longer. I suggest at least shooting for like 30 minutes. I've had some patients stay outside for an hour. I think the longer the better, just because that's how we're designed, especially for that early morning sun exposure. We don't have to worry about sunburn and all this kind of stuff, right? We're much less concerned about that in the early morning. Now, midday comes along. And again, I do think it's important to get outside. I personally think we need to be getting midday sun exposure on our belly, right? So that would require no shirt, et cetera. I think it's really good for the microbiome. There's studies that support this. Now we have to start being a little more concerned about things like sunburn. Now, we have this natural mechanism in our skin that starts to alarm us when we're getting too much sun exposure. And what you'll notice is you'll start getting that kind of tingling, kind of warm feeling, and then your skin starts to turn kind of pink. That's your skin saying seek shade, right? So you have this built-in mechanism. That duration of time is so different for everyone. Anything from the darker your skin tone to the lighter your skin tone to just your sensitivity to light in general. All of those things are going to determine how long you can safely be in the sun for that period of time. And just to confirm, I am talking about sun exposure with no sunglasses and no sunscreen. Obviously, if you're putting sunscreen on, you're kind of destroying, the whole purpose of being there. So for me right now, I've kind of lost my tan or my solar callus, what I like to call it. So I would only need to be outside midday for probably 10, 20 minutes, right? And if I do that consistently, I'll start to get this nice tan back. Over time, I can spend an hour, 2 hours without, getting a sunburn. Again, that time's going to vary for each individual. The early morning, I will argue, probably the most important time to set things in motion. Again, 10 to 15 minutes to optimize someone that's already healthy, 30 plus minutes for someone that is suffering from some type of condition.
And in the morning, also like important to get full body exposure too, or like should say, yeah.
The more the better. The more the better. Obviously, if you're in an urban area and it's illegal to be naked outside, let's not do that. But if you can take your shirt off, whatever, sit on the porch. Yes, the more skin exposure, the better.
And then if someone's in a rainy area, like let's say someone's in Seattle where, it's or Portland, Oregon, and they're getting a lot of rain. And so that you might go a few weeks without sun exposure. So is that when they might want to rely more on like the LED lights? Or?
Absolutely. I've heard this discussed from multiple angles. I've heard it discussed that, hey, you can go outside and you're still getting, a good exposure, but what you see clinically is it's still not really enough to well, especially for some people, to change things like seasonal affective disorder, right? Where you see increase in depression, and you can even see elevations in inflammation and all kinds of things actually start to occur. So I do champion the use of whether it be LED or laser. I don't want the take-home message to be Crawford said go do a tanning bed. That's not what I want the take-home message to be. But I have had people where I'm like, dude, at least go to a tanning bed. Like do something, right? And that person actually did respond well, and it helped them to come out of their depression. But yes, that is a really good example. I will say still being outside on a cloudy day is better than not being outside. You might need to be outside longer. Actually, I will say you will need to be outside longer on that cloudy day, but the sun is still shining through. I've played with this myself. There's an app. It's called Light Meter. I think it's free. I don't remember, but I'll use this both indoor and outdoor to measure the light intensity because I'm a nerd. But I've actually measured, light intensity on a cloudy day versus a sunny day. And it really varies. Sometimes it's not as affected as you would think. So you're still getting a good exposure. I would say just increase your duration, but definitely leverage technology like laser and LED if you do live in those places, in my opinion.
Now, getting back to laser therapy and thyroid health, for someone, let's say they have Hashimoto's, Graves', and I know the answer to this is going to be everybody's different, but can you give a ballpark idea of how many sessions they would need? How many, like, would it be a matter of weeks or months that they would need to receive treatment?
So, and you're right, it does depend. And here's the example I'll use. I was working with a lady. She had really bad Hashimoto's and primary hypothyroid, and her antibodies were immeasurable. So it just said over 1,000. Both the TPO and the thyroglobulin antibodies were immeasurable. So we started working through diet. We started working through all these different things, and her antibodies came down, I think, to like the maybe 500 range, something like that. And we kept working, and I just couldn't move the needle. I was like, man, what the heck's going on? And finally, I started thinking like, okay, emotional stressors, like start talking about her life and everything. It's like, okay, how's work? Great. How are kids? Great. How's your husband? I freaking hate him. I was like, whoa, hit a nerve. So I had them start in marital counseling because they had not done that. And literally, as things began to improve in the marriage, the thyroid began to improve as well. And I just say that as an example of like, everyone is going to have different triggers. Some people, it may be more food. Some people, it may be more emotional or chemical or infectious or whatever it is, right? And so you can use the laser over the thyroid. You're going to see results. You're going to see mitigation of inflammation. Antibodies will typically come down rather quickly. Okay, I will say that. Usually within the first few applications, they'll start to come down. And that's also consistent in the literature, right? It's not like we have to use this for 3 months to get a small change. Like, you will start to see changes rather quickly in the lab work. But to continue to really move the needle, man, you got to find what triggers that person, really are responding to and address those, as you know. But yeah, you'll see changes in labs pretty dang quickly when you start lasering the thyroid appropriately.
Awesome. What other conditions do you commonly use laser and light therapy for? I know TBI, like traumatic brain injuries, also pain relief, it could help benefit as well.
Absolutely. Our laser is cleared for pain, but it's also cleared to improve blood flow in the body and mitigate inflammation. So, me clinically, right, I'll use the laser on anything that I'm trying to accelerate and heal, right? So, we use the laser every single day for our traumatic brain injuries. We're well known for TBI of any type, whether it be anoxic or whatever, right? So, we're healing the brain every single day with this laser. Spinal cord injuries respond extremely well. Chronic regional pain syndrome, some of the worst types of pain conditions that you can imagine. We see those on a regular basis and use the lasers on. Chronic infectious issues, post-COVID syndrome. I'm beginning to see a lot of post-COVID, whether it be, they can't smell, or they still have the brain fog, or they have a pain syndrome, or they have whatever it be, right? We're using lasers in combination to help that as well. Neurodevelopmental disorders is huge. That's what my fellowship is actually in. I'm a fellow of the International Board of Functional Neurology with a specialty in childhood neurodevelopmental disorders. And so we naturally see a lot of autism, ADHD, dyslexia, Tourette's. I personally also had Tourette's, no longer have that anymore. So we're using this across the board in some of the most complex neurological conditions. But what I'll also say is we're beginning to see a huge shift in the mentality of the market. And this is in the space of what I'll call the biohackers. I'm beginning to see some really high level CEOs, athletes, these types of people that they either want to gain an edge or they want to maintain their edge. So I worked with someone here recently. He was, at the helm of a multi-billion-dollar company, and he said, "Man, I'm just tired all the time. I have brain fog." So we're working with him in that way. And within 2 weeks, he said he had a 25% improvement in his abilities to function at work. And we saw the metric. We see the changes in the metrics here in the office. Same thing with athletes. So that's the cool thing. Again, no matter what you're doing, photobiomodulation can help. In fact, my wife was just she was getting some work done at her biological dentist. And that dentist uses our laser with her patients. So that was super cool, right? So this thing can help in so many different ways, in so many different demographics. It's just an amazing tool.
Wonderful. Any contraindications, concerns? I don't know, pregnancy, can laser therapy be used, or any other concerns or contraindications?
Sure. Well, I think since you do talk about the thyroid a lot, I think we do need to kind of dispel the myth of the thyroid. So many people think that you cannot laser over a thyroid. I will say that's a myth. There's enough, like I said, I know of 20 different peer-reviewed articles that show you can, and not only can you, but you should. You just need to know what you're doing when you do it and have some guidance and whatnot. Cancer is one of those weird things where you're going to be told, no matter what you're using, don't use it over cancerous lesions. I have had some experiences with patients with terminal cancers, and they wanted to use photobiomodulation, and we actually saw very positive effects from it. But especially from a manufacturer standpoint, we have to say not to use over cancerous lesions. The biggest thing that I see and want to tell people about are seizures. Laser therapy can be very powerful when it comes to reducing and eliminating seizure disorders. But like I explained earlier, we don't want to jump straight to those high energy photons. So there's a stepwise progression of how to do that. I wouldn't say it's contraindicated. It just needs to be done properly. As far as anything else, you mentioned the pregnant belly. Well, there's not a study, nor I don't think anyone's going to donate their pregnant belly for someone to laser over, right, to see how it influences the baby. What I will tell you is that I regularly advise pregnant moms to go outside and get proper sun exposure to their belly, right? Because that light from the sun is being transmitted into the developing baby, and it does help with growth and development. So I think that good light exposure, proper light exposure to the baby is very, very important. Do I laser over it? No, I don't think I want to take that risk. I don't advise taking the risk either. I did do a whole podcast over a discussion about the development and neurodevelopmental disorders because of different types of light exposure and what that does in neural crest cell migration, et cetera. But those are the main concerns. One thing I will bring up as well, and we were literally just writing this into our literature for our laser. I don't advise people to put that laser directly over clothing when they're using it. And the reason is because clothing will absorb those photons. Skin will transmit the photons, right? So anytime I'm using the laser, I want it to be over the skin. I don't want it to be over clothing. The one time that I've seen a patient burned from one of the lasers that we use, he had a long sleeve black shirt on, and it was not in my office, it was in someone else's office. This doctor gave the patient the laser and said, hold this here. It was on his arm, and walked away. And the patient just, literally put it directly on top of the clothing on the arm. And the clothing got so hot that burned the skin. And so because of that, I just have this rule like, hey, if we're going to laser you, no clothes. We don't want to laser on top of clothes. It doesn't make sense from a physics perspective anyway. We want a full delivery of those photons. So that is, I guess, what I would call a contraindication, or just a.
How about the eyes? Concerns with the lasers in the eyes?
Thank you for bringing that up. So, man, talking about all these things I was diagnosed with, it sounds like I was pretty bad off, but I was diagnosed with glaucoma as a kid. So literally, I was diagnosed with glaucoma, early onset, et cetera. They said, look, you're probably going to lose your vision someday, whatever. We'll monitor it. Don't really have a solution for you right now. So fast forward, when I was going through college and learning about diet, nutrition, and all these things, I started taking higher doses of DHA, vitamin A, all of these things that can promote proper eye health and retinal health. That slowed the progression. At that point, the glaucoma did not worsen. Then I got into chiro school, started working with Dr. D'Onofrio, and he was like, laser your eyes. And I was like, wait a minute, I'll burn my eyeballs. It's called a scotoma. I don't want a sunburn on my retina. And he said, no, just laser your eyes. I was like, okay. So I came up with this method where I would close my eyes. I would bring the laser close. When I started to see red, I knew it was starting to influence the retina. I knew I was getting the eye. So it wasn't a direct laser beam on my eyeball. So I would do that just for like 30-second increments, right? So I started doing this very regularly. For the first time I went into the ophthalmologist, it got better. And they were like, oh, okay, well, this is interesting. This is good. We see this sometimes, but, don't get your hopes up. So I continued, got better again and again and again. And now I'm not even diagnosable. Now, I did start using both red and infrared in order to do that. So I've personally had good experience with that. I have neuro-optometrists that use our lasers for various eye conditions like macular degeneration. There's actually now evidence that we should be using red light for macular degeneration. That is in the literature now. So it can be used on the eyes. Now, obviously, we want to be doing this under the guidance of a properly trained physician because, yes, you can also burn the retina, right? So you don't want to misuse it. One of my pilot studies actually is looking at how we can very quickly change someone's brain state by lasering transretinal, by lasering through the eye. The cool thing about the eyes is it is an extension of brain tissue. So this is diencephalic tissue. It also does not have a bone between the eye and the brain. So it is like a fiber optic for photons going directly into the brain. So if I know what type of brainwave I want to put someone into, so I need to increase beta waves or whatever, I can actually use a proper wavelength, and I usually use near infrared like an 808 or a 975, and I can laser transretinal for short periods of time and actually see their brain waves change right before my eyes. I've done this multiple times. So, is it a relative contraindication to laser the eyes? Yes. However, as literature progresses, we're actually seeing that laser and light therapy can be huge and effective to treating so many different eye conditions and, like I'm talking about, the brain. Super exciting.
All right. No, that's great. Yeah, glad I brought that up because, yeah, I think that's also important too. So thanks for sharing. And before we wrap things up, again, I know that we could, I'm sure, talk another hour about this, but anything else that you felt the need to share, or if you just wanted to kind of summarize for those who might be, or give some advice, someone who might be dealing with Hashimoto's, Graves, or even a non-autoimmune thyroid condition who might be interested in utilizing laser and light therapy.
Sure. My overarching mission and everything that I do is I want to change global healthcare. And a lot of that does involve, incorporating things like photobiomodulation into the hospital setting, into the private clinic, into the dental office, into whatever it is, right? Because it's such a safe and effective modality. Whether you're struggling with a thyroid problem, some other type of autoimmune condition, pain syndrome, or you're just trying to optimize your neurophysiology, right? You just want to gain an edge. Laser and light therapy can be something that may be the missing piece. It can absolutely be supportive in nature of whatever you're doing, right? So whether you're someone wanting to do this on your own or you're someone that really needs, the guidance of a physician, there's solutions out there. If you wanted to engage further and learn more, I've got some resources on drbrandоncrawford.com. So that website can kind of point you in various different directions. But yeah, man, I'm just here to change global healthcare. I think we're doing a good job. I think you're part of that movement and all the great work that you're doing as well. So however I can, support patients and clinicians, I'm here.
All right. Awesome. So in addition to the website, so drbrandоncrawford.com, anywhere else people could find you, social media or?
Sure. Social media is really cool because you get to see a lot of patient testimonies. Instagram is where I'm most active. So it's at B Crawford DC. So it's B as in boy, my last name Crawford, D as in dog, C as in cat. So at B Crawford DC. That's going to be my main social media outlet. And then, of course, I've got the Neuro Solution Centers. So I have neurosolutionatx.com is my office here in Austin. I also have Neurosolution ATL in Atlanta, and then Neurosolution DXB for the Dubai office. So we have all of those options as well. But again, if you go to drbrandоncrawford.com, that should point you in all the different directions that you need to go.
All right. Well, Dr. Brandon, thank you so much. This was really a great conversation. I mean, I expected it to be great, but I mean, we again just was even better than better than expected. So I think you exceeded expectations. And again, thank you so much for sharing your experience and knowledge with us.
Absolutely. Thank you so much for having me.